Anna came to Oxford in 2012 and joined haematology in 2023 into Oxcom to support patients in early stages of diagnosis, mainly early stage A CLL.
Hi, everyone. Thank you very much for the invite. So I'm quite a newbie compared with Leanne. I joined Oxcom in 2023. My main role is to support patients on stage A CLL and other conditions, but my main role is focused on CLL stage A. In Oxcom, so Oxcom was created to support the GP practices, to support patients that were in stage A CLL. Can I just ask, and I'm sorry putting you on the spot, who here has a CNS as a point of contact? Okay, so quite a few that don't. Okay, thank you. I must say I do love what I do. I'm very passionate what I do, and I'm very lucky to be part of this. And I truly believe that it's really good to have a point of contact with a CNS, a clinical nurse specialist. Just because I think, well, the contact it's direct, it's easier, and we facilitate different way of getting in touch with us. So our role obviously involves not only managing the condition and symptoms, but it's more than just CLL. Obviously, being passionate, it's providing the best care and being there to listen, and not only focus on the CLLs, but all the concerns you have from health conditions, mental health, personal issues that are affecting you personally. So our role involves a lot of things, and it's important for us to know that that we're there, available as a point of contact. And our role involves a lot of things. So it starts from the moment you come to clinic, and since the moment you have the first point of contact and the diagnosis is given, and in this case, Leanne usually in Oxford is the main point of contact, the first point of contact, and Leanne is present when the diagnosis is given. Obviously, like this was mentioned before, there's the big C that's associated, and obviously the word leukemia. And I think it's fundamental to have an additional support besides the consultant who gives the diagnosis, but having that initial person that is there to support and to give you some more guidance on what the actual diagnosis involves. So at this stage, initial information is given, points of contact, information on the condition, how to reach the hospital, symptoms to look for, and obviously this is then followed up, at least in Oxfordshire, it's followed up by a follow-up call weeks after diagnosis, just to go through the information and make sure we answer all your questions. So through the service that is provided by the CNS, we do run a telephone clinic where we do monitor the blood tests. And usually we start with a close monitoring to begin with, especially if it's a new diagnosis. And from then on, we do a regular monitoring on your bloods, on your symptoms. So we provide our direct contacts just to make sure that in between appointments, you can reach out if you're concerned with any symptoms, if there's anything that is bothering, anything that is not sure, there's no small question, there's no small concern for us. It's important to know that we're there, and if there's anything that you're not sure about, you can always reach out. And if there's obviously any symptoms of concern, any new symptoms, any new lumps, we can always bring the appointment forward and review blood tests, and we always liaise as well in the MDT, and if required, then we'll bring you to clinic. So there's a teamwork. So we work very closely with the consultants and the GP practices. If there's any concerns that are are raised from the bloods that are not related to CLL, these will not be forgotten. We will liaise with other teams, with specialist teams, or even the GP practice to make sure this is followed up. I'm sorry, I don't want to kind of overload with a lot of information, but just to make sure that, all the information is brought up. Part of our role is mainly as well focused on the education, what the condition involves, especially as is a chronic condition, making sure that, you know what symptoms to look for, and there's a bit of proactivity if there's anything that you're concerned about and it comes up in between appointments, you know who to reach out. In Oxford, we have a triage system as well. Is a service that is available 24/7, which in case if you feel unwell and especially out of hours, you can always reach out to the service. And so it's always, you can always seek the GP as well and the CNS if you have one available. In case when you're in treatment, if there's any concerns or if you want to discuss possible treatments after having the initial discussion with the consultant, the CNS will always be the point of contact as well. We facilitate the space and the time to inform about the possible treatments, what involves, what possible side effects you can expect, how many times you expect to go to the hospital, and how will that affect your day-to-day life when you're into treatment. We do work as well as a point in between, a bridge, if you may call it, between GP practices, consultant hematologists, and you personally, and making sure that all the information is shared. And obviously, if there's any concern, this will always be raised up. I'm not sure if everyone is aware of the holistic needs assessment. Usually this is offered at early stages when the diagnosis is given. So not everyone needs to be part of it, but it's just to make sure that any needs are assessed, and if you need any additional support, we can post sign for other associations or the services offered by the community or even by the hospital. Oxfordshire has the psychological medicine team that is able to support as well when a cancer diagnosis is given. So there's a lot of support available. It's obviously getting to know what is available out there. And the CNS, it's a good point of contact to make sure, you can access that information and what's the best way of reaching out. So there's obviously all, the guidance during the nursing consultations. We go through the possible symptoms and all the, support about, we're talking about some safety, vaccination guidance, the B symptoms, and we always discuss the blood results as well, and make sure that you get familiarized with the terminology of the blood results. Initially, it's a bit scary because you wouldn't be used to kind of go through your blood tests. But once you start being monitored on a regular basis, you start getting familiarized, and some may opt to kind of get a record of the blood results or even graphics, and that sometimes may kind of help understand what's the progression or the stage of the condition of the CLL. Okay. And I'll pass you now to my colleague Leanne.